Deja, thank you so much for all of your help tonight. We are truly grateful. And first and foremost, I want to say welcome and thank you all for joining our telephone town hall on California's coronavirus response with a special focus on Marin County this evening. The most important part of tonight's town hall is to hear from you. We're going to spend as much time possible answering your questions and your comments. We already have had over 350 questions and comments sent in over the last 48 hours, and we want to hear from you tonight. Please email us now at senator.mcguire@senate.ca.gov. senator.mcguire@senate.ca.gov. We are now 750 strong on the line. Again, welcome to the town hall. My name is Mike McGuire, and I'm honored to work with you as senator here in Marin County. We have an outstanding panel of leaders and experts joining us tonight. Before we get into the town hall, I want to first make a few brief opening remarks. I think that you would agree with me that this has been an incredibly tough month for everyone in Marin County and throughout the state. And it's amazing how much life can change so quickly. The good news is this: because of the early and decisive action taken by Bay Area counties and public health officers, including Dr. Willis, that early decisive action has saved literally thousands of lives, not just in Marin County, but throughout our region and throughout the state. And while virus numbers are growing, the rate of spread has now slowed. And this is thanks to your incredible hard work and, candidly, your sacrifice. And on the other side of the coin, we know that cabin fever has started to set in for so many. More importantly, we know that we're facing incredible challenges with our economy. So many small businesses are hurting, and so many of our neighbors are struggling to pay their bills and put food on the table. What's happening tonight would have been unthinkable just a few weeks ago. That said, here's what I know. Marin County comes together like nowhere else on earth to help when neighbors are in need. Our communities pull together when times are tough, and this is for sure no different. I know that we're up to this challenge, and together we are beating this virus back. But we have a lot more work ahead, and there's a lot of sacrifice as well. But together we're beating the virus. We're working overtime with the Marin County Board of Supervisors to ensure the county has resources needed to respond to this crisis. And please know that we're going to be here for you now, and we're going to be here for you in the months and years to come. I now would like to be able to go over the flow for this evening and introduce our speakers. Back for his 5th telephone town hall, we're grateful to have Dr. Brewer. Dr. Brewer is one of the state's best infectious disease physicians. He's from UCLA Geffen School of Medicine, and he's going to be kicking us off in just a few moments. We're then going to turn the town hall over to the Marin County Public Health Officer, Dr. Matt Willis. He's going to be talking about the confirmed number of cases, the current status of preparations, when does he think the peak will hit Marin County, and what could opening up the community really look like. We're then going to have our Superintendent of Marin County Schools join us. That's Mary Jane Burke. She's going to focus on a distance learning update. We've been getting a lot of questions about graduations and will high school graduations happen later this year? And what should parents be prepared for this fall? Our superintendent will be covering each of those subjects. And finally, we're going to hear from the chief economist from the Marin Economic Forum. He's also a Sonoma State professor, and his name is Dr. Robert Eiler. He's going to be giving us an overview of where he believes the Marin County and Bay Area economy will be now and into the next 24 months. He's going to talk to us about how long he believes the recession will last and how small businesses should be prepared for a potential soft opening later this spring and into the summer. We'll also have the chair of the Marin County Board of Supervisors. She's going to be answering questions and providing a very important closing statement tonight, and her name is Katie Rice, and we are grateful that she has joined us as well. After we hear from our panelists, we're then going to turn it over to the most important part, and that's hearing from each of you. Again, email your questions now to senator.mcguire@senate.ca.gov. First and foremost, though, we want to hear from our experts. Let's turn the floor over to Dr. Brewer from UCLA Medicine. Each panelist will have a maximum of 3 to 4 minutes. We'll give a 30-second prompt, making sure they know that their time is almost up. Dr. Brewer is going to provide us with a statewide update on the coronavirus. Dr. Brewer, the floor is yours, and we welcome you tonight.
Thank you very much, Senator McGuire. I'm delighted to be able to join everyone tonight. And please let me also add my thanks to everyone listening for the tremendous sacrifice and wonderful job that you've been doing, staying at home, wearing masks. It really has made a difference, and I'll take you through some of those numbers. So right now, as of yesterday, we had about 24,500 cases of COVID-19 in California, 821 deaths. In the country as a whole, we're at over 600,000 cases and about 24,000 deaths, a mortality rate of about 4% in the country as a whole. But let me tell you a little bit about the wonderful job that you're doing and the state of California is doing. So when the Centers for Disease Control and Prevention look at how fast cases are rising, in the country as a whole, at April 7th, which is the most recent data we have, in the previous week, cases went up so that there were about 120 cases per 100,000 population. The California rates were one-third that, so our rate was 40 per 100,000. And that's a direct result of the social distancing that everybody is doing, the staying at home, and the wearing the cloth coverings and the masks when you go out. So the sacrifices that you are making are translating into real protection in our communities. And so you should be very proud of what you're doing. So where do we stand in the country as a whole? Case rates have actually stabilized a little bit. And when they look at people presenting to emergency rooms and doctor's office, people presenting with COVID-like symptoms have actually declined a little bit in the last 2 weeks. Unfortunately, our mortality rates have gone up a little bit, so that as of this past week, about 7% of deaths, all deaths in the United States, were felt to be related to COVID-19. So while we're not out of the woods yet, there is potentially some light at the end of the tunnel. I want to also briefly just touch on antibody tests, which you may have heard be coming down the pike. An antibody test is a test of the immune system to see if it recognizes an infection. So we do these tests to see if your body has been infected, and most of those people have recovered. Those tests are not yet in place, but should be in place in the next week or two. You may have also heard about people taking antibodies from people who have recovered and giving them to people who are sick. That is a strategy we have used for other viral infections and will be using in COVID as that becomes available. And we can talk about more of that in the question and answer period. Finally, I just want to again get back to how COVID-19 spreads. So this is a respiratory virus. It's spread when people talk, when they cough, when they sneeze, and generally you have to be within about 3 to 6 feet of someone who's infected in order to catch the infection. That's why the social distancing is so important, and that's why the face masks are important and the cloth coverings, because what they do is they catch those particles as they come out of your mouth, and they get caught in the mask or in the covering, and they can't be spread to someone else. These particles can land on surfaces, but in general, viruses do not live a long time outside the body. So if you're shopping in the grocery store and you pick up cans and boxes, if you just set them on your pantry shelf for a day or two, they will be totally fine. The virus will not survive that long. And if you just make sure when you get home, you wash your hands, you wash your fruits and vegetables, you keep your countertops and other surfaces clean, you'll be doing everything you need to do to protect yourself from the virus. So I think I'll stop there, Senator, and looking forward to the question.
Dr. Brewer, thank you so much. That was a wonderful overview, and our goal for tonight is to make sure that you're hearing from the experts on the front lines. We just heard from Dr. Brewer from UCLA Medicine, giving us an overview of the virus. We're now going to turn it over to the public health officer for the County of Marin, and that's Dr. Willis. He'll be talking about the confirmed number of cases, the current status of preparations, when does he see the peak hitting Marin County, and what could opening up the community look like? Dr. Willis, we're grateful for your service. The floor is yours. You have 3 to 4 minutes, and I'll give you a 30-second prompt.
Great. Thank you, everyone, and thank you, Senator McGuire, for convening this important conversation. I want to start by just acknowledging my gratitude for our community for taking the behavior changes and the steps that we put in place in the shelter-in-place order. And this has really been the success that we've had so far in flattening the curve regionally is really thanks to you. And the success of the past, I think, has been in your hands, and the future is also in your hands as we think about potentially lifting certain elements of the shelter-in-place. And I'll cover that briefly. Let me start with just offering some of the numbers for us in Marin County. So we have, and this is, I'm going to go over some of the elements on the dashboard that is publicly available to all of you under coronavirus.marinhhs.org. And one of our goals is to make sure that you're as well informed as you can be in terms of our response. And we're trying to make as much of this information publicly available. And this is updated daily at 4 o'clock. So I'm just looking at the dashboard now, and I'm seeing that we had 13 new cases diagnosed in Marin County since yesterday. There are 2 people who are currently hospitalized in Marin for COVID-19. That's the lowest number we've had since the first spike in cases about a month ago. We have had 2,343 people who have been tested for COVID-19 in the county, with 184 total cases cumulatively since the beginning of the epidemic. 32 people have been hospitalized. Again, only 2 are currently in the hospital. And we've had 10 deaths. 128 people of those 184 cases have recovered from COVID-19. Those are the current statistics. I know one of the most important issues that people are concerned about, and has come up a lot in the last few days, is the potential lifting of shelter-in-place orders. The regional order ends on May 3rd, and I'm just going to briefly review the principles that we are, in conversation with other health officers, going to apply to that process. These are some of the prerequisites that we expect to see in place before we would consider changes to the order. First, that the healthcare system is prepared for surges, including having adequate PPE available. Second, the testing capacity to identify cases early and having the workforce to perform the contact tracing and making sure that we're identifying cases early and being able to actually isolate cases and quarantine those contacts needs to be in place. We have to have a monitoring system. Similar to the dashboard I just went over, we want to make sure that we have a system for actually early identification of any impact of changes in the shelter-in-place order. And then finally, that the public, that you all are equipped and prepared to execute the social distancing, covering our face, frequent hand washing, and other principles that would allow safety as we begin to potentially roll back some of the elements of the shelter-in-place. It will be a slow and sequential and thoughtful process. It is not an on-off switch. It's not going to be, all elements will not be lifted simultaneously, but rather it will be something that we take item by item independently and consider based on the potential risk of transmission for that activity or that sector, and taking into account the social benefit of that activity or the harm of continuing to prevent that activity from occurring, will be those principles that we apply to any changes in the shelter-in-place order that might come in the coming weeks. And I'll end with that, and happy to have questions if they come up.
Thank you so much, Dr. Willis. 30 seconds or less. can you just address really quickly, when do you expect the peak to hit Marin County?
Yeah, I avoided that question partly because the modeling is, is very difficult to predict, and there have been a variety of different models suggested with wildly different estimates. We are seeing that the curve has really been flattened in Marin County, and we are seeing fewer cases. Again, there are lower numbers in the hospital now than we ever had, and so we think that we have successfully flattened the curve. We have limited community-based transmission. Any surges that we expect to see would be out of congregate living facilities such as prisons, jails, skilled nursing facilities, and others, where we might have clusters of cases. Really, the next surge would likely be related to lifting of the shelter in place. And if we start instituting those changes in May, that might be the earliest that we would start seeing new surges.
Thank you so much. Dr. Willis is going to be with us tonight to be able to answer your questions. Senator.McGuire@senate.ca.gov. We're getting dozens of questions in. Keep it coming. We're going to get to as many questions as possible in just a few moments. We're grateful to be able to have the County Superintendent of Schools with us this evening. Her name is Mary Jane Burke. She'll be giving us an update on distance learning, talking about graduations, as well as what parents should be prepared for this fall. Superintendent Mary Jane Burke, the floor is yours. You have 3 to 4 minutes, and I'll give you a 30-second prompt. We welcome you.
Great. Thanks, Senator McGuire, for including me. I, too, want to express my thanks to the entire community, but most especially I want to thank our teachers for their unprecedented flexibility, dedication to kids and families, to the parents who have taken on the unthinkable as they try to go on with all of their responsibilities, including, quote, teaching their children. Matt, to you and our public health partners, we wouldn't be able to move forward without the ongoing efforts. And then, of course, to our essential workers, whether it be those of you that work in our hospitals or in our grocery stores, we're just so appreciative. Who would have thought just a few weeks ago, and so I think everyone's aware that the school system moved from March 13th to having students in school to March 16th, our schools were no longer able to serve our kids in the traditional ways. What I'm so proud of about Marin County in particular is that we decided we were going to move forward and go ahead and figure out what we could do immediately. And that is, the analogy you hear sometimes, we're building the plane while it's in the air, and that's exactly what we decided to do. And as you may know, there are places in our state and country who took 4 full weeks before providing any opportunities for kids or families. So for that alone, I'm so thankful. There's terms we now know that we perhaps wouldn't have, whether it's Zoom, Canvas, Google. There's Learning Ally. There's so many different ways that our teachers are working to ensure that our kids are having the access that they need, whether it's through virtual, live, or recorded lessons, student work packets that are provided by kids, some that provided by teachers, sometimes through the telephone. It is nothing short of amazing. I want a special thanks to one of my colleagues, Liz Schott, who has led the opportunity in Marin County for all the districts to work together to ensure that we're able to have a portal that will be available for teachers throughout the county to access the most up-to-date information related to distance learning and lessons that are so very important. I want to just note, though, that the issues around personal engagement and interactions are so critical. As we know, it's that relationship between the teacher or other member of a staff and the student that is really when miracles are happening, and we are working so hard to try to figure out how to maintain that level of relationships. And our teachers are, calling kids individually, trying to make sure that they maintain those connections. I want to address the issue briefly of equity and access. Some people think about Marin County and say, well, there's a lot of people with much privilege and opportunity, but we must remember that 30% of the students in our community are socioeconomically disadvantaged. And what that means is a family of four is making less than $644 a week. And what does that mean? It means that very often they're hourly workers and they've lost their jobs. It means that they may not have access to technology through internet or the Chromebooks, etc. And so right now we're working hard to ensure that our families and kids, particularly the most vulnerable, have the food they need, but also access to devices and connectivity. In Marin County, we need approximately close to 300 devices right now, and we need almost 700 new hotspots. Okay, let's go to graduation. I want to just remind everyone, for some of us it was a long time ago, but there's a rite of passage, right, that our young people are so familiar with and they've seen come before, whether it's the prom, the grad night, the actual graduation ceremony. And we are trying as a community within Marin and in the Greater Bay Area, trying to figure out how we're going to address those issues. I want you to know that the teacher leaders and students throughout our community are talking with the young people to try to figure out what's the best way that we can do this. And in fact, I have a meeting tomorrow with the high school principals first thing in the morning to hear what it is they're thinking. But I want us all to be reminded that, for some, they may say, oh, big deal, graduation. Actually, graduation is a big deal. It's a milestone for young people. It's one we need to honor and recognize. And so it will be really important that we come up with strategies, and the strategies need to come from the students. And approximately soon after we found out that the school year would actually not reopen all the way through June, I had a chance to talk to the student body president at one of our schools and said, hey, what do you think? And he said, I just heard about this. I'm in shock. I need a little time. And so I think as we think about being kind, we need to know that our young people are going to be thinking long and hard about this. All right, next question. What's school going to look like?
30 seconds, Madam Superintendent.
Okay, what's school going to look like next year? It's hard to know, isn't it? We don't know. Here's what I can promise you. We will be working with Dr. Willis and Lisa Santora through public health to be sure that we understand fully what conditions will be necessary to ensure that we can open our schools in a way that is safe for students and for staff. And if you listen to some of what we're hearing, we know that we'll need the appropriate sanitizers, et cetera, available to us. We'll need to potentially look at different ways of students convening. Perhaps we won't have PE in the same way. We won't have so many students in the halls of the school. We might be working with smaller cohorts, which may require us to consider schools that would be essentially open for longer periods in a year-round school strategy, or some students go to school, early, some later in the day, et cetera. All of that will require all of us working together, but first and foremost, we'll be focusing on what is public health telling us about what conditions need to be available. Thanks for that. Sorry.
No, you're good. Thank you so much, Madam Superintendent. We're grateful for all your work, the teachers' work, classified employees, all the administrators. We are truly appreciative. We are now going to turn it over to our chief economist. Chief economist from the Marin Economic Forum, it's Rob Eiler. He's going to give us an overview of where he believes Marin County's economy will be over the next 24 months, how long he believes this recession will last, and what businesses should do to prepare for a soft opening. Doctor, the floor is yours. You have 3 to 4 minutes. Mr. Eiler, we welcome you.
Thank you, Senator. Thanks also to all the healthcare workers on the front line and the doctors with us today. So yesterday, the International Monetary Fund put a forecast out for the global economy, including the United States, set off to the side, and their growth rate for this year forecasted is supposed to be 5.9% negative. Next year, the 4.6% positive. And they have not predicted to 2022. So to think about the duration of this episode, we should be thinking probably until 2022, to where we get back to more or less where we started this year and where we thought we were going to be by 2022, assuming some things happen, and I'll talk about those in a minute. Generally speaking, the California economy lags a little bit behind the U.S., but the Bay Area tends to be initially lagging and then suddenly going ahead of it based on the last 4 decades of growth, with the idea that the Bay Area economy generally is the ultimate engine of the U.S. economy as we go from recession toward a boom period and beyond. Local housing and equity markets are going to somewhat dictate what an economist would call a wealth effect in terms of residents and workers to be able to sustain themselves over the next few months, assuming we have social policies lift by, let's say, sometime in either late May or early June. Local employers in Marin County are likely to be pressured depending on the industries they're in, and I'll come back to this in a second, but the continued restrictions after the social policies are lifted and how consumer demand reacts with both how consumers are left with their jobs or not, and how federal policies, including some of the checks that should be landing in the next few days in people's accounts, are able to, in a sense, act as a bridge over troubled water between this current episode and actually getting back to work. So much now depends in terms of the economics on the number of cases. So assume that Marin County's unemployment is going to surge in April and May, and after that, the social policy hopefully will be lifted and we will start slowly moving back to normal. But the data really remain at bay in terms of economists doing really strong forecasting, even at the U.S. level, much less at the state and the county. But assume 2022 to get back to square, assuming a lot of things I'm going to talk about in a minute come to fruition. The length of the recession depends on how deep we go and how many businesses are ultimately lost. That's why the Federal Reserve's policy, the congressional policy in terms of fiscal stimulus are all very focused on businesses staying in business and workers staying in their jobs. If workers start to lose their jobs and from that consumer demand sags enough to force a lot of businesses to decide whether or not they're going to stay in business, that's really where you have initial detriment becoming a long, depressed episode economically. So the more that we can keep those two parts of the economy together, specifically in Marin County, but more completely in the Bay Area, the state, and the U.S. economy, businesses staying in business, workers still having a job, or at least having the income to help other businesses remain, but because their demand is not going to go down for goods and services, that's going to help at least calm this episode and make the downturn less deep and hopefully the duration less long. There's a lot of discussion about this being the same depth as the Great Depression. That may be true in terms of the initial depth. No economist right now is forecasting we will have a decade seemingly lost because of this episode. We should recover more quickly than we did in both the Depression and maybe in the Great Recession. But the Great Recession is probably a relatively good gauge about where we might be going. Finally, in terms of a soft opening, expect that there'll be a rolling opening and it won't be, okay, everybody can go back at once. Part of that will be because they're going to want to sort of expand the definition of essential businesses and slowly move out from the current environment in a way that makes sense, and they want to sort of avoid a lot of, let's say, social costs and everybody going back at one time. So there'll be a rolling probably opening of the economy again. One of the biggest problems when we open is whether or not we have a threat of seeing a repeat performance on this. So businesses should be thinking about checking on their insurance, engaging in as many federal programs as they possibly can, trying to make sure their workers engage in those federal programs as much as they can. If they can split hours a little bit and change shifts and try to maximize the potential for income and also jobs to remain in place, that's very positive for the economy going forward. But assume a lot of industries are going to have additional costs by the time that everything opens back up, and there's going to be new requirements and additional costs of doing business, at least over the next year and perhaps for the next few years. Marin Economic Forum has been talking about this for a long time, and we've been talking about business resiliency, making sure businesses have plans and insurance. Your local chambers, SBDC, the local governments have all been part of this, in a sense, movement to try to get businesses to be more resilient, especially given the local disasters we've seen. And so people have asked me to describe this episode in terms of a disaster. It really is almost like Hurricane Katrina's effect on New Orleans and also Butte County's fires, not so much the Sonoma County fires in 2017, but Butte County's fires in 2018, and how devastating that was really to the entire county economy. That's now generalized itself across most of urban America and also urban California because the economies have basically gone to sleep for the time being. So that's what we're looking forward to in terms of business reopening, and those resources are here with your chambers in the forum in Marin County to help that turn be a little bit more simple and hopefully more fruitful.
Mr. Eiler, thank you so much. We're going to have more questions for Dr. Eiler here in just a few moments. We're now going to get to the most important part of tonight. We want to say thank you to all of our panelists. We want to say thank you to Supervisor Rice, who will be joining us now for this lightning round of questions. We've asked each of our panelists to be able to keep the responses to 30 to 60 seconds so that we can get to as many of your questions as possible. Email us now, senator.mcguire@senate.ca.gov with your questions or comments. Let's go to our first question of tonight. It's coming in from David. This is going to go to Dr. Willis. Dr. Willis, David asks this: What circumstances with the coronavirus have to prevail for it to be relatively safe for everyone, but especially vulnerable populations, to begin to return to activities where we interact with others in any of the activities we're used to doing? Dr. Willis, the floor is yours.
Yeah, I mean, I try to outline some of what we see as the prerequisites for any real lifting of the most restrictive elements of the shelter in place. We are, I think, close to achieving those prerequisites currently in terms of making sure that our healthcare system is prepared for any surges. We know that, the benefit of the shelter in place that we've put in place thus far has effectively limited transmission and has flattened the curve. The problem with that and the challenge that represents is that, therefore, there are a large number of people in our community, in fact, a vast majority, who are still susceptible, who have not been exposed. And so, as Mr. Eiler said, there is a real risk of a second surge if we were to be too aggressive in terms of lifting that. We are also, and to the question, we will be making sure that as we lift elements of the shelter in place, will be continuing to protect those who are most vulnerable to severe outcomes and mortality, and making sure that our older residents are continued to be, more sheltered in place than others. And we will favor increasing access to social interactions for our younger population, who we know do better if they're exposed.
Thank you so much, Dr. Willis. This next question is going to be for Dr. Brewer from UCLA Medicine. Dr. Brewer, Kathleen is asking, what is the difference between an N95 mask and a cloth mask? Which one should I be wearing?
Thank you, Catherine, for your question. A cloth mask is fine. So an N95 mask is designed for illnesses such as tuberculosis, and healthcare workers wear them when they're working with patients who have what are called airborne diseases. Coronavirus, COVID-19, is a respiratory virus, and really the point of the mask is so that if you're infected and you don't know it, when you go out, those droplets you produce that may have virus in them get caught in the mask. So the goal of the mask is really to prevent spread of disease on people who are wearing it out in the community, whereas the goal of the N95 mask is to protect the healthcare worker from a disease such as tuberculosis.
Thank you so much. And obviously those N95 masks, Dr. Brewer, should be prioritized at this point for healthcare professionals. Would you agree with that?
Definitely. There is no reason anyone needs to wear an N95 mask when they're out in the community.
Thank you so much. We're now going to go back to Dr. Willis, the Public Health Officer for Marin County. This is coming in from Jamie this evening. Dr. Willis, Jamie asks, why can't some system be put in place for online time-sensitive parking permits or license plate-coded access time to allow for our citizens to access Marin's vast natural resources? Dr. Willis, the floor is yours. We'll also ask the chairwoman of the Board of Supervisors to chime in on this as well. You have 60 seconds, Dr. Willis.
Yeah, thank you. We are considering strategies for as we consider the next chapter of this shelter in place. One of the principles of what are those activities that are least likely to lead to disease transmission, and we know that in general things that occur outdoors are less risky, and we also recognize that it is an important benefit for all of us to be able to, especially with the cabin fever that Senator McGuire referred to, that we really do need for our mental and physical health to be accessing the outdoors. So I can say that those strategies that would allow us to control crowding in accessing our outdoors are active elements of our conversation with the other health officers, and we would take a regional approach to that question.
Thank you so much, Dr. Willis. Chairwoman Rice, any other comments on that question?
Yeah, I think I can add something. I mean, there's another element to consider when we think about access and opening up access to our open space and parks and trails, and whether that's the seashore, Stinson Beach, or a regional park here in Marin County, is that when we have lots of people flocking to the open space, they're parking in places and creating actually emergency access issues. So that was also part of the one of the elements that needed to be considered when we saw the crush of folks heading to the out of doors on that first nice weekend in March, is that we actually were creating a dangerous situation because there was not good emergency access in case something were to happen that needed an emergency response. So we definitely feel for everyone wanting to get out and access the open space and get some exercise, and I think that we will be able to devise some ways to maintain social distancing and also control the parking situation so we don't create a second problem beyond the COVID transmission issue.
Thank you so much, Supervisor Rice. We're going to stick with Dr. Willis. Dr. Willis, this message is coming in from Jerry. Jerry has a question about a potential outbreak at San Quentin Prison. He is asking, will inmates or correction staff hospitalizations overwhelm Marin General Hospital? That question is coming in from Jerry. Dr. Willis, Public Health Officer, Marin County.
Yeah, we are in active conversation with the California Department of Corrections to partner on addressing the challenge of a facility like San Quentin Prison, where you have a couple thousand inmates in close proximity, to make sure that they have that they're on their A game in terms of protecting against infections, and then early detection of potential cases and isolating people rapidly, because we know that from fortunately not at San Quentin, but other settings like that, other prisons in the state of California have seen large outbreaks. We are the current strategy would be to cohort individuals, if there were cases in that inmate community, to cohort them at the facility, and we're talking about what we call an alternate care site, which would be essentially a field hospital at that facility, so that they have the capacity to manage any inmates who may be sick enough to require health care for that to occur at San Quentin. And that is primarily the responsibility of the state. We are serving as a support for those activities.
No, absolutely. Appreciate that, Dr. Willis. On a call on Tuesday with the Secretary of Prisons, the main concern for prisons has not necessarily been in Northern California, but in particular two prisons, especially Chino in Southern California, but continued monitoring and constant communication with San Quentin obviously is going to be key. We're going to go to Dr. Brewer. Dr. Brewer, this is on the antibody testing. You covered it in your opening, but I'm going to have you cover it again. I'm looking to Carrie Lindecker, who is working the questions tonight. Are we over a dozen questions on antibody testing? She wants to know, when exactly do you believe antibody testing is going to be in mass production? And can you please address the status of testing so that we may know how many of us have been exposed, and what are they testing for? Is it a blood-drawn test or a saliva-drawn test? Dr. Brewer.
So all terrific questions. Let's take a step back and talk a little bit about testing. So there's two ways to look for infections in people. One way is to look for the actual bug or the pathogen, and that's the PCR test that we have available now. So we're looking for a piece of the virus, the COVID-19 virus. The other way to test for infection is to look for an immune response to the presence of a bug or a pathogen. A classic example of that would be the HIV test. That's an antibody test. So an antibody is a protein that your body makes in response to an infection. And we use those tests to tell who or who has not been infected. So you need a working immune system to generate an antibody. The antibodies take about 1 to 2 weeks to start to show up. So they're not great tests to look for people early on in infection, but they're wonderful tests for screening populations to see how many people have had infection in the past. And I expect those tests to be rolling out within the next week or two. Widespread, you're probably talking more about like 3 weeks or 4 weeks.
Thank you so much. Dr. Brewer, UCLA Medicine, we're going to stick with you. A similar question. This one is coming in from Minerva. Minerva asks, if you are asymptomatic, would an antibody test still show that you're positive for the coronavirus? That's from Minerva. Dr. Brewer?
So Minerva, it would depend on where you were in the infection. So early on in the infection, if you're asymptomatic, first few days, an antibody test will be negative. As I said, it takes about a week to 10, 14 days for the immune system to start to generate those antibodies where we can actually pick them up. Now, most people will eventually develop symptoms, usually anywhere from 2 to 14 days after they get infected. So by the time symptoms have rolled around, and certainly by the time you're feeling better, antibodies should be detectable. But if you never had symptoms and you just recovered, an antibody test would show that you had been infected in the past.
Thank you so much, Dr. Brewer. Well said. We're now 883 folks strong on the line. Thank you for joining us. If you have a question, senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. This next question is going to Superintendent Mary Jane Burke, Marin County Schools. This question is coming from Aaron. Superintendent, you addressed this in the beginning, but I got to tell you, we're getting dozens of questions now about graduation and prom. And I'm going to paraphrase Aaron's question here. With schools being closed for the remainder of the school year, will once-in-a-lifetime opportunities like prom and graduation ceremonies be scheduled? What do you think? Superintendent, you have 60 seconds.
I think no, not in the way that we've seen them before. If what you're framing is that all the students would come together, families would be there celebrating with them in a graduation ceremony. One of the things we know from our public health partners is that large gatherings are in fact one of the things that it will take some time before we might consider again. And when I say some time, it might be a great deal of time. And so at this point, what people are thinking about is what are the possibilities of virtual gatherings that could also provide for young people a celebratory event. But I would say no. Matt Willis or Dr. Willis, might you add anything to that from your public health perspective?
Yeah, I mean, it's really unfortunate that some of the things we value most are large gatherings, whether it's worship services or other festivals, concerts, et cetera. And those were, if you look back, even before the shelter-in-place order went into effect, those were the first things that were prohibited in an effort to prevent COVID-19 transmission in our community, and will be the last to be lifted because the risk for transmission is so high when we gather so many people together from across our community. So an option would be doing it, later, perhaps, once we've sort of seen the full arc of the epidemic curve, and it's hard to know when that might be, but, if that were as early as the fall, it's possible that there could be, these celebrations might occur, but in a delayed fashion.
Thank you so much. Thank you so much, Superintendent. We're going to be sticking with Dr. Willis, Public Health Officer for Marin County. This message, this question is coming in from Bob. Bob has some statistics. So, Dr. Willis, I know that we're doing this quickly, but if you can confirm, please. Marin, this came in a day ago. Marin has 154 total cases and 10 deaths, which represents 6.5% of total cases. Bob wants to know why you believe our death rate percentage is more than double all the other counties in the Bay Area when you compare the Bay Area statistics. Can you comment on Bob's question, Dr. Willis?
Yeah. I mean, the current data is we have 184 cases, I think, and 10 deaths. Still, that is higher than most other counties, and we've known that we are particularly vulnerable as a community because we are also demographically the oldest community and the oldest county in the state. So we have a higher proportion of people who are at risk for more serious outcomes, including hospitalizations and deaths. All of the deaths in Marin County are in people who have been above age 65, which is consistent with that. And that's one of the reasons why we really need to maintain our vigilance around social distancing. And as we continue to consider lifting elements of the shelter in place, that those policies really do continue to protect those who are most vulnerable, especially our elders.
Thank you so much, Dr. Willis. We're going to be coming back to Dr. Willis momentarily. We're now going to go to Dr. Brewer from UCLA Medicine. This message is coming in from Tom. Tom wants to know, why are more men dying from the coronavirus than women? Dr. Brewer, you have any thoughts on that?
Oh, terrific question, Tom. The short answer is no, but you're right. So that if you look at mortality rates overall, about 57% of the deaths are occurring in men. Some of that was felt to be that particularly early on in China, men in China are much more likely to smoke than women, and we know that smoking increases mortality rates. But why that is, we don't have a great answer, but that's actually not limited to COVID-19. So in general, women live longer than men, and men die at higher rates of heart disease, lung disease, and other infections besides COVID-19.
Thank you so much, Doctor. Dr. Willis, anything else you want to add to that?
Only that, yes. I mean, we're seeing the same pattern here in Marin County, where we're seeing more men who are being affected than women in our hospitalizations as well. I can give you the numbers exactly. So 57% of our cases in Marin County are men compared to 43% of women, and similar exactly for our hospitalization rates. So what we're seeing epidemiologically across the nation, we're seeing also here.
Thank you. We're going to go to a tag team on these next two questions. We're going to ask Superintendent Mary Jane Burke and Dr. Willis to be able to tag team. We'll first go to the superintendent, then we're going to ask Dr. Willis, the public health officer for Marin, to comment. Number one, this is coming in from Sharon. Superintendent, do you believe that students will need to wear masks in the fall? Number two, how do we handle school meals in the fall? Superintendent, and then to Dr. Willis.
I don't know if we'll need to wear masks, but if that's what it takes to get our young people back into school, I'm for it. That's number one. Number two, related to school meals, I believe that we're going to need to figure out different strategies. As you may know, we've spent quite a bit of time over the last years providing students with healthy options, and so very often you see salad bars, and perhaps we will not be able to provide that type of an option as we start the school year. So I'll stop there. Matt?
Yeah, I mean, I think masks. When we talk about kind of what is the new normal going to be for us across our society, I think we're just all going to have to get more used to masks and the appearance and feel of what it feels like to be wearing a mask. We know that that's one of the most effective strategies to prevent infection, especially given that we know now that people can be asymptomatic for up to 2 days, prior to the development. I mean, can be infectious for 2 days prior to the development of symptoms. And so it is likely that we will be recommending, as a complement to lifting some elements of the shelter in place, need to make sure that we're on our A game in terms of other interventions we'd be taking, including mask wearing. So that decision has not been finalized, but I would not be surprised to find the recommendation is mask wearing in schools when we resume.
Thank you so much. The biggest theme of the night are the issue of masks. We're going to stick with Dr. Willis, and we're going to go to We're going to then go to Dr. Brewer. So this next question is coming in from Mayor Ford Green in San Anselmo. Here we go, Dr. Willis. Does it make sense that masks be required rather than recommended? How can the wearing of masks be required rather than simply recommended by public health? Dr. Willis, the mayor of San Anselmo, Ford Green, that's where the question came from. Why don't you give the answer?
Yeah, I mean, this is an active conversation. One of the, we are working as a region for the shelter-in-place order, and I'm speaking, daily with the health officers of the 6 counties that implemented the first order in the nation, and we are, talking about shifting from a recommendation to an order for mask wearing. Obviously, it's been a strong recommendation to cover your face in public, and we see a lot of compliance with that. But we also see some people, importantly, who are not. The biggest concern there is people who are working in sectors where there's public interaction. In grocery stores, even healthcare workers who may not be masking up. So the first order that is being considered is requiring those individuals who have, face-to-face contact with the public as employees or use masks. One of the concerns about public order around mask wearing, and it's already put in place in Sonoma County, is the obviousness of, when someone is out in public without a mask, and the implication that would have to be enforced on the street by law enforcement every time they encounter someone that's not wearing a mask. And whether or not that's something that raises questions around equity in terms of its enforcement, making sure that every individual actually has the ability to have a mask before such an order would be put in place. And those are some of the active questions. But it is likely to be forthcoming that we would be at least issuing an order for certain sectors to wear masks who are public facing.
Thank you so much, Doctor. So I'll be honest, that gets us to our next question for you. If this is mandatory, is it going to happen now or later in the spring? Going to ask you to do a quick answer on that. Then we're going to go to Dr. Brewer.
I can't say when the timing would be. It would certainly be, an important complement to any elements where we would relax certain elements of the shelter in place, which wouldn't happen until May.
Thank you so much. We're now going to go to Dr. Brewer. Dr. Brewer, we're sticking with the issue of masks. Top question tonight coming in are all about masks. This is coming in from David. David says, I heard that the face mask is not able to keep the coronavirus from getting into our eyes. If the virus lands on the mask and then it enters our eyes, will he, let's see here, I'm trying to read it. Will he become positive for the virus?
So, David, there are a couple of components to your question. So the first is, how do you get infected? And so you get infected by the virus landing on a mucosal surface, and that could be your eye, your conjunctiva, could be your nose, could be your mouth. So you are correct that a mask will not cover or protect the eyes. But the goal of the mask is actually not to protect you from infection. So when I'm in the hospital, to protect me from infection, I'm wearing a mask and a face shield. The goal of the mask, as Dr. Willis said, is to protect the community. So also, to hearken back to the mayor, we're all in this together. We're a team. And the reason that we're wearing a mask is we might be infected. We might be asymptomatic, not know we're infected, but capable of transmitting that infection. And by wearing a mask, the droplets that I'm producing if I'm infected are not going out into the community. They're getting caught in the mask. So the goal of the mask is not to protect you from getting infection. It's to keep someone who might be infected but doesn't know it from spreading.
Thank you so much, Dr. Brewer. We're now going to jump back to the superintendent of schools. Superintendent, this next question is coming in from Scott. Has there been a decision to change grading to pass-fail? Is this a statewide or a local decision? And what do you feel will be the long-term impact of the student by making this change? Superintendent.
The answer is it's definitely a local decision and will be made district by district. The State Department of Education has provided guidance related to things to consider. There has been a conversation with the CSUs and UCs, and they have promised that if a school district goes to a credit, no credit, which is the terminology, or pass, no pass, credit, no credit, that no student will be affected related to that decision, and that they will not be, and this year, as you may know, in addition, there will be no SAT, ACT testing. So given the remarkable, uncertain, evolving times, there is a great deal of leeway and flexibility that's being provided. When you look across the state, different school districts are approaching this issue in different ways.
Thank you so much, Superintendent. And Superintendent, we had the same question coming in from the Vice Mayor, Tiburon Holly-Thier, so we are very grateful to both the Vice Mayor, Holly-Thier, as well as Scott for sending in that question. We're now going to go to Robert Either, the Chief Economist for the Marin Economic Forum. Dr. Either, this coming in from Miles. Miles has gone to 2 national banks. I'm not going to name them, but they say that the Paycheck Protection Act is oversubscribed. He's unable to get a Payment Protection Act loan. Can you fill us in about where we're at with the Payment Protection Act and those loans for small business owners?
Yeah, thank you. So what we're hearing on the street is that the amount of money that Congress initially passed, about $1 billion a day, is going out the door, with the idea that and very quickly it could be $10 billion a day. And if that happens, then the first so-called tranche of money is going to be gone. But it sounds like Congress is going to let another tranche go because they're recognizing the need and also the popularity of the program. So we're waiting to see that happen. But we should assume that the first round is going to run out in its current amount, that Congress is likely to put more money in there for both political requirement and also for economic requirements.
Thank you so much, Doctor. We're going to go back to Dr. Willis, the Marin County Public Health Officer. Dr. Willis, this is a personal question. It's coming in from Niz. She wants to know, how are you feeling? She had heard that you had the coronavirus. Can you talk about it? And how are you doing now that you are recovering? Dr. Willis, personal question. The floor is yours.
Yeah, thanks for that question. I mean, I'm feeling well. I'm back. I'm here at the Emergency Operations Center. Yesterday was my first day really formally back to work. I did have the antibody test that Dr. Brewer referred to, and did have a strong signal for those protective antibodies, and have had no fever for over the last week. I think my firsthand experience with this virus really just reinforced my conviction that this is something that we really need to be doing our best to work together to fight. It was a real challenging 2 weeks for me in isolation in my own home, in the upstairs bedroom, with no contact with my family in the house, and about 10 days of really just being stuck in bed with the viral pneumonia, and so this is again, I was fortunate. I'm relatively healthy, and just the experience was something that I did not expect, and I underestimated the severity of symptoms. Obviously, people have a wide range of symptoms. A lot of people have no symptoms at all. There's asymptomatic people who are infected. A lot of people have mild symptoms. About 10% of people end up in the hospital. But that other remainder of people who get sick and might develop that viral pneumonia, but who can stay at home, and that's my group. It's a pretty significant illness and lasts for a couple weeks. So I'm really glad to be back on my feet, and I appreciate the support of the community. There was a lot of well-wishing and meals left on our doorstep and cards, and that really helped us get through.
Dr. Willis, we are so happy that you're with us, and being able to share that personal experience, while incredibly challenging, you have walked a mile in the shoes of so many in this nation and across the state, and we are so grateful for your service. And we are going to keep the focus on Dr. Willis for a moment, We're going to change gears a bit to talk about exemptions with the stay-at-home orders. We've been getting a lot of questions tonight, Dr. Willis, on landscapers and on folks who own hair salons. So can you define, what is the definition of landscapers? Are they exempt or not? Number one. Number two, a lot of folks who want to get a haircut, candidly, are saying, when will hair salons and barbershops be opened back up? Landscapers and hair salons, Dr. Willis, these are your two questions.
Great. So we're talking about lawns that are getting overgrown and hair that's getting unruly.
That's right.
In terms of landscaping, it's not the sector specifically, landscaping per se. It's the activity that the people would be engaging in currently in the shelter-in-place order. So if the work is basically trying to reduce fire fuel, close to the house, then a landscaper can engage in those activities because we think that's important to make sure that there's no debris, there's no large branches or trees that it might have fallen where there might be contributing to the risk for fire. So it doesn't make so there are landscapers currently working in Marin who are complying with the order because of the nature of the activity they're doing on site. Just landscaping for cosmetic purposes or gardening for cosmetic purposes is currently prohibited under the order. However, when we apply the principles of how we're going to think about the next stage in terms of shelter in place, outdoor activities where social distancing is possible are probably the kinds of activities that we might think about lifting first. We haven't made any specific decisions about what sector or what activity would be included as an allowed activity in the next one, and that's where I would put the question around hairdressing. And we just I don't want to get too far into the specifics because we're still really just trying to think about what are the principles we'll be applying to.
So candidly, those who, and I'll include myself, we're going to continue to be shaggy for several more weeks, it sounds like.
Yes, it's possible.
All right.
But we're all in it together, right? We're all looking a little shaggy.
You're absolutely right. And we barely wear pants anymore, and we don't have haircuts. So it's, it is what it is at this point. We're going to get back to the questions. We're going to go to Dr. Brewer. Dr. Brewer, this is coming in from Tara in San Anselmo. Tara asks, is the coronavirus the next polio? Should I be homeschooling my preschooler and kindergartner until we have a vaccine? So we're going to go to Dr. Brewer, and then we're going to go to the superintendent. We have time for a couple more questions, and then we're going to need to wrap up. Dr. Brewer, then the superintendent.
So, Tara, the short answer is no, it's not the next polio. I think the technology that we have available today, and the superintendent can address that much better than I, for homeschooling and for virtual teaching is much better than they had in the 1950s. Remember, the polio vaccine came about around 1957. So they spread differently. So this is a respiratory virus. Polio is a gastrointestinal virus. But I think that we have technologies available to facilitate teaching today that we did not have back in the 1950s. I also think that we will be able to develop a vaccine much more rapidly than they were for the polio virus.
Thank you so much. Let's go to the superintendent quickly. Superintendent.
I would say that many of our families right this moment are considering what they're doing as homeschooling. In that the children are home and they're being provided support through technology and packets, etc. But nonetheless, the parent is finding themselves in a significant role as it relates to their child's learning. My hope, of course, and I think that the interactions in school between child and teacher are so very important that my hope is that if we see the ability to bring kids back to school in the traditional way, that I will look forward to that day. And if we need to make modifications in order to ensure the safety of children and staff, we look forward to that. And I think potentially we might end up with some combination.
Thank you so much, Superintendent. We're going to go into some real quick answers here. We have time for a couple more questions. This is coming in from Catherine and Brian in San Rafael. We're going to ask Dr. Brewer to start, then we're going to go to Dr. Willis. Catherine and Brian say, we like to support our local establishments who offer takeout, but only with assurances that it does not pose harm for transition of this virus when bringing the prepared food into our homes. So, Dr. Brewer, talk to us about, is takeout safe? Number one, the containers that takeouts come in. Number two, the bags where employees put the containers. Number three, the food that folks eat. And then we'll go to Dr. Willis. 3 points on takeout. Dr. Brewer.
So, Catherine, I'm actually getting takeout tonight because I'm here with you and won't have time to cook dinner. So, viruses survive in cells. They do not survive long outside of bodies. This virus is rapidly destroyed by disinfectants. So if you wash your hands with soap and water after handling the containers, you will eliminate any virus on your hands. That will protect you. The viruses are killed by heat. So cooked food is not a problem at all. So the short answer is do get takeout, support your local business, just wash your hands when you come home after handling the bags and the containers, and you will be fine. And don't worry about the food at all. Cooked food, there's no evidence to suggest that cooked food transmits this virus.
Thank you so much. Dr. Willis, follow up?
Yeah, I agree. I'll be grabbing some takeout on the way home after this. And just to reassure folks that the county Department of Environmental Health Services is responsible for all of the restaurant inspections that happen at baseline with the scorecards they have for their hygienic practices, and they have done a lot of aggressive work and proactive work out in our restaurant community to ensure that all the facilities that are actually offering takeout are practicing the best practices for preventing any potential spread in that setting. So there's a team that's actually really on that currently out in the community under environmental health.
Thank you so much. We're just about to wrap up, and we are so grateful. We're still 800 strong here tonight. We're going to have our final two questions. These questions came in last week. They're serious. I'm going to go to Dr. Brewer. Dr. Brewer, 30 seconds or less. Can I get the coronavirus from my cat?
No. So
All right.
The short answer is cats can get coronavirus, so it's more likely that you will give it to your cat than your cat will give it to you. But if someone were to cough on your cat, if you just wash your hands, you will be fine, and the virus will not survive in a long time on the surface of a cat.
Thank you so much. The final question tonight is coming to us from School Board Member Jackson in San Rafael. We're going to turn it over to Dr. Willis quickly and to the Chairwoman of the Board of Supervisors, Katie Rice. Can you please describe what the county is doing for our immigrant community? Dr. Willis.
Yeah, I mean, we are working very actively in the Canal District, with really and other areas. Our immigrant community is primarily, demographically, our Spanish-speaking population, and we are making sure that all the materials that we're developing in English are being translated into Spanish, and we have close relationships with the Canal Alliance, the Canal Welcome Center, and other groups, community-based organizations that are trusted within that community and serve as our liaisons to that community, to ensure that all of our messages are translated and then they're getting the same support that other members of the community are. In addition, Marin Community Clinics, which is our largest community clinic, serves 40,000 residents. About 30,000 of them are Spanish-speaking, and they've been in very close contact with us and are making sure that the clinical needs of that community are met, including testing needs.
Thank you so much. Supervisor Rice, 30 seconds if you would like to add to this, and then we're going to turn it over to Supervisor Rice to be able to provide a closing comment on behalf of the County of Marin. But first, Supervisor Rice, on the immigrant community, the floor is yours.
Yeah, thank you, and I appreciate the question, Linda. Thanks for asking it. And Dr. Willis kind of explained how we're reaching out with our Health and Human Services into our immigrant communities. And I think what I would add is huge concern on the part of the Board of Supervisors and the county at large. This segment of our community who has probably been really hardest hit possibly in terms of the economic hit that the COVID-19 has placed on us. And we early on put a considerable amount of money into some programs, whether it was food expansion or food access, rental assistance, financial assistance to a community which we know it has probably the least resources to fall back on, and such an important community population to this community in terms of the services they provide across a range of sectors in Marin County, and those happen to be the sectors in which the job losses came quick and came hard and may exist for quite a while. So I appreciate the concern, and it's a focus for the county.
Thank you so much, Chairwoman. Chairwoman, we're going to turn the floor over to you to be able to provide a closing comment on behalf of the County of Marin, and I want to say thank you to all of our panelists. Fantastic job tonight. We answered just about, let's see here, Carrie, 24 questions tonight, so thank you so much. Chairwoman, the floor is yours. Closing comment.
Yeah, well, thank you, Senator, for hosting this and for the other town halls you've been doing, and just your excellent communication at all levels through this crisis and generally. And also thank you to the experts on the panel. I'm a big believer in getting out of the way of the experts, and so was glad that most of those questions were directed at the appropriate folks in terms of getting the response. It was fact-based, science-based, and not a political answer. So I just want to I just want to reach out to our Marin County residents, everyone who's on the line. You know, we have really stepped up in so many ways, whether it was our public health officials helping to lead the Bay Area-wide shelter in place. We, as individuals, we've stepped up. People honored and have adhered to the shelter in place and the social distancing for the most part, and it's made a huge difference. We really did flatten the curve, and that was so critical because it really did give our experts in healthcare and our disaster response and preparedness people the time they needed to really expand capacity, build up the protocols and the relationships, and actually start to get that supply chain in place, so that if and when we do have a surge, we're going to be so much better prepared to deal with it. So I want to thank, we've all played a role, frankly, in the job well done that Marin has done so far, and I want to thank you. So I think that it's also, we're facing now this reality that we know a full-on shelter-in-place is really not going to be sustainable, especially at the economic level. At the same time, I suspect that our professionals there in the medical field will say that we're not going to be able to get to a full return to normal. It's not going to be possible until we've got a vaccine in hand and or that herd immunity that will be protecting us. And so they are being tasked with, our medical professionals, and hearing from the community and understanding the economic impacts. They're being tasked with making a determination around what's probably the ultimate balancing act between reopening our communities to a more normal interaction and business level, and yet keeping our population, especially our most vulnerable, safe. So this is not going to be easy. The decisions that get made around how the shelter-in-place gets lifted need to be really well-informed and made carefully. And I think it's critical, one of those elements that Dr. Willis talked about in terms of monitoring as we make changes and phase back in, to be able to monitor and gauge what sort of impact negative it is having in terms of maybe more folks getting sick and seriously sick. And then I think that we also have to, as a community, continue to remind ourselves. So many of us are chomping at the bit to get back to normal. We have to remember there are a lot of people in this community that are at high risk, and for them, a return to normal may be actually a very frightening thing to contemplate until there is a vaccine or that herd immunity. So I would ask that everybody continue to have confidence in our public health officials, in the team that we have here in place in Marin County that's preparing us for what may come. Have patience with each other at home and also with this process, and also compassion because this COVID-19, as Dr. Willis experienced himself, is just nothing to mess around with. And what we've done so far has masked probably that threat because we've been so successful. We could have been another community. We could have been in a situation more like what we're seeing, of course, at a large school in New York. We have not lost lives. We have done very well. We need to continue to stay the course, listen to our experts, and we will start to phase in that normal over time. I know it's coming.
Thank you so much.
And that's all I have to say. Thank you, Senator. Thank you, panel.
Thank you very much. We're so grateful to the chairwoman of the Marin County Board of Supervisors, Katie Rice, for joining us. We want to say thank you to our panelists, Dr. Brewer, Dr. Willis, the Superintendent of Schools, Mary Jane Burke, as well as Dr. Eiler from the Marin Economic Forum. We're grateful to the nearly 900 that joined us tonight. Thank you so much. Our goal for this evening was to be able to provide you with the most up-to-date, accurate information from the experts on the front lines combating this virus. A few housekeeping notes. The recording of this telephone town hall will be available through the County of Marin as well as our website tomorrow evening. The County of Marin will have a copy of this, and they'll be posting on their social media channels. If you need assistance related to unemployment, please call our office at 916-651-4002 or any other virus-related issue. We're doing this every Wednesday evening at 6:30. We look forward to working with you in the weeks and months to come. Stay healthy, stay strong, and please stay home. Thank you so much for joining us. This town hall is now concluding. Have a great evening.